With COVID-19 numbers increasing locally and across the nation, health experts say that folks need to be vigilant about following COVID-19 recommendations to stop the spread, and that includes during the holiday celebrations. In today's 2-Year Wellbeing, we're going to take a look at how you can still celebrate while still staying safe. All right, Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder, is joining us now to kind of go over those first few questions of like, what are the recommendations for holiday celebrations? So many people have questions about what they should or should not be doing.
So very much like the recommendations that we put out for Thanksgiving, those still hold. The risks are still out there, and I would say even greater as our prevalence in our community is higher. So celebrating with the people that you live with is the safest. Anybody that you bring into your home, even like your college student, represents a somewhat of a new risk coming into your home. And especially if you want to have extended family come over, those are choices that place vulnerable family members at risk because they don't live with you. And the key thing is still adhering to the 3 W's, and I guess if people are still considering getting together or saying hi to a loved one, make it brief and still 6 feet apart and outdoors, where there's good ventilation. But if you really are having like a family dinner, it is that includes more people outside of your household. It is very risky.
All right, so what is the thought process that if people don't follow these recommendations, they don't follow the 3 W's, that what will happen?
So we've seen plenty examples of that already in our community. Many of the jumps in cases that we've had over the last 14 days is in direct relationship to Thanksgiving gatherings. So as you know, our state has had so many more COVID-related hospitalizations. And before Thanksgiving, we were in like the 2,100 hospitalizations, and now we have 2,800 on average over the last week. And it all points, at least I would say over half, some link to family members being together with Thanksgiving.
All right, so let's also talk about non-COVID related recommendations for a safe and healthy holiday season, because we have, of course, Christmas and we have New Year's before we're all getting this whole year started.
Correct. There is some thought, if people are trying to take their family somewhere just to go up to the mountains but be by themselves, or if they're joining with like another group, we would recommend getting tested where your results come like tested just a couple of days before you go. And so you kind of know what your status is in a way. And then also after, if you've had traveled, especially if you think about traveling by air, you may be encountering people in the plane or in the airport that might be sick. We would recommend that you can get tested anywhere from 3 to 5 days after your trip, just to see if you possibly have gotten exposed. I think the thing that's so difficult about SARS-CoV-2 is that we know when you don't have any symptoms, you are still highly infectious. And that's the part, that's the stinker. You feel fine one day, you're with a group of people, the next day start having symptoms, but all those people you were with are now exposed.
Mm-hmm. During the holidays, it's one of the biggest times of year for people to get sick, have a heart attack, those other regular everyday kind of medical emergencies or sicknesses. So a lot of times folks second guess themselves, especially with COVID here, about going to the hospital to be treated.
Correct. I feel like, if you have symptoms that you previously would want to go to the emergency room, you still should go. Do not defer the care for chest pain, for dizziness, for weakness in your face or your arms or legs. All that still needs to be addressed emergently. A lot of the hospital systems have split their waiting rooms, so that's people with respiratory illnesses on one area, and then the other area, they try to separate folks and based on their symptoms. And they are trying to kind of assess them as quickly as possible and making sure that patients are not exposed to each other. And again, right, by wearing a mask all the time is not only protective for yourself, but to others as well.
Right. And a final message for safety wise for the rising COVID cases, the holiday season, both of these things happening at once.
So we really need everybody to be exceptionally vigilant right now. And the holiday plans that you may have had sharing with other families or your extended family, just keep it to your own household and then give us just a few more months. We have to really ride this wave that we're having. And once it trends down, once more vaccine is available in the community, we can safely gather. But at this stage, it is, to me, not worth to put my loved one at that exposure.
All right, Dr. Snyder is going to be with us until 6 o'clock answering your coronavirus questions. And here's how you get your question answered. You text your question. Don't call, but text 336-379-5775. We're going to spend the rest of the half hour working to get your questions answered. We'll be right back.